back to the Nurse Nook. So today I'm doing a little bit of a different video. I'm doing a collab with my friends that are both in nursing school. Well, this one finished. He has his BSN because he's bougie. And
B stands for bougie.
We are still in nursing school, so you're kind of going to get like a different perspective of things. We're going to talk about like common misconceptions that people have about nursing school. Well, first let me introduce them. This is
Adam.
This is Priska. So we're going to talk about some common myths that people have about nursing school. My first misconception is people think that you can't have a queasy stomach at all to be in nursing school. That is a lie, because there's still things that I see that make me like things that smell bad. What does it for me is like broken bones. Like, oh my gosh, the broken bones, like I swear it gives me goosebumps and like the hair just stands up. I can't see that. So don't feel like you need to be like, oh, nothing bothers me getting into nursing school. But because there are nurses that have been nurses for like 25 years and there are still things that like make them like, ugh. But
for me, it's colostomy bags.
Yeah.
If you have one, I'm not being offensive. I swear, I just cannot. I can't stomach it.
I
cannot. For me, it's the same thing as her. It's like odors. And you know, patients can't help it, but I've kind of trained myself to like go into a patient's room even if there's no odor. I just hold my breath and I breathe in through my mouth. But if you breathe in through your mouth, you're kind of eating it. So it's kind of like, would you rather sniff it or would you rather eat it?
Or you can always go in there and put some Vicks underneath your nose.
So yeah, you do not have to be like a brick stomach to be a nurse. Like it you get over it.
Another thing for me is wound care. I was just like, can you get the wound care nurse in here? Because
sometimes wounds are like,
So for me, a misconception would be not being able to work and go to nursing school. I'm sure like maybe in grad school I won't be able to do it, but for right now I work, I'd say between 25 to 30 hours a week, and go to school probably my first semester I had class every day, so 5 days a week, and I was working 5 days a week. So say for instance I would work 2 to 11, so I'd say I'd have class all day and then I'd go to work at 2. So I know like after work at 11, that means I'd go straight to studying and then wake up early in the morning and then just do it all over again. But it's definitely doable. Time management is key. Knowing how to manage your time, knowing when to study, actually dedicating that time to study, and you'll be fine. Like, you know, I made it through my first semester and I got A's and B's. So
yes, queen. Smart
and
queen.
I was getting the coins, so
the queen do it.
To be real, you gotta admire people like them, because I don't know how they did it working.
Yeah, it's a lot.
My myth is just that a nurse is just kind of, I mean, it's not about nursing school, it's about nursing in general, but that nurses only listen to the doctors, and you definitely learn in nursing school that that's not the way it is. As a patient advocate, you're going to the doctors many times and saying, hey, you know, this patient needs this, and obviously you need an order, so the doctor will go in there, assess the situation, and decide whether it's necessary or not. But again, a lot of the times, you know, we're going up to the doctors are not telling us what to do, kind of thing.
We're not like doctors' puppets. A lot of people think that we're like, the doctor's like, oh, do this, and we're like, okay, yes, sir. Like, we assess things, like, we recommend what to do with the patient a lot of times.
Honestly, a lot of times the nurse could probably diagnose and figure out what is wrong with the patient, but obviously we can't diagnose. But like a lot of times they know, like they've been around it, so they know.
Especially like seasoned nurses, like a lot of times they're like correcting the residents that make orders and stuff. They're like, I don't think this is right. Like, you need to change this, or like, I think we should do this. So we are not puppets. We
have brains.
Yeah,
we're surgeons.
My second myth is that you need to know what field you want to go into as soon as you get into nursing school. That's a lie, because when I first got into nursing school, I thought I wanted to do like NICU, and now I'm like, I want to do like ER, trauma, like adults, and sometimes I even question that. Like, it's all over the board, because you start learning about so much and like so many different specialties, and then you have observation days and like certain units, and you find what you like. So don't feel like you have to have your whole career plan and be like, okay, I'm going to do this for 2 years, I'm going to do this. Like, you find things you love in nursing school that you didn't think you would love. before and you just go with it. So don't feel like you have to have everything set up basically before you start. Go in with an open mind.
So another one for me would be, another myth would be people who think that you have to have like a 4.0 to be successful in nursing school. Well, that's not true.
A lie.
Because I don't have a 4.0.
I don't have a 4.0 either.
And he's graduated.
Yeah.
So,
Yeah.
Obviously grades are very important. You obviously need passing grades, but
Yeah.
grades aren't everything, because at the end of the day, you can have an A student and you can have a C student. And
That doesn't
you're
mean
in a
that
room
you're
with a patient,
yeah.
and the A student only knows book stuff, when the C student automatically reacts to a situation and
Yeah.
helps the patient.
That's
So
very
which
true.
one do you want? Honestly, I'll take the C student because I don't want to die. But so at the end of the day, it's not about your GPA and you have to have an A and all that stuff, and like, don't ever sit there and compare yourself to your classmates, because a lot of them will really, like, I don't know if you guys had it in your program, but some people in my program are like really competitive and like, you know, oh, I got this on the exam. I'm like, okay.
Oh, yeah. Okay.
And you can see it, like, a lot of times you can see people that are strictly there because their grades got you in, and like, I always say that nursing is like 50 like academics because you need it, like,
Obviously,
yeah. But 50 is like the personality that you have, because you can't just walk into a patient's room dry
Yeah.
And
know?
start spilling out medical
yeah,
terms to them.
Yeah, it's holistic care. That means not
Mhm.
just physical, but mental, emotional, all those different things. Yeah.
True.
Oh.
Ooh.
So my second myth is that at the end of nursing school that you have to know everything about nursing. You have to hit the ground running.
Yeah.
That couldn't be further from the truth, because when I started my preceptorship, I was nervous. I still had a lot of questions, and you know, you're there for 6 weeks, the last 6 weeks of nursing school. So you're there for 6 weeks, and you know, when you get a preceptor who's trained, like, you're there to ask questions, you're there to participate, and you should be asking questions. Don't be like going into it like, I have to let these nurses know that I know everything even when I don't, you know, like,
Because
again,
that's when you make the most mistakes, is you act like you know something when you really don't.
exactly. And your preceptors are trained to, they accept the responsibility of a student, which means that they accept the responsibility of answering questions. And, you know, even the seasoned nurses don't know everything, and they have to go ask questions. So
Right.
don't feel like at the end of nursing school you're supposed to know everything, because even nurses who have been working for 40 years don't know everything. So
Don't feel like you have to know that.
exactly.
And even when you're in clinical, like, there's some students that feel like they should know things, so they're scared to ask like their nurse or clinical instructors about things. Honestly, this is your time to look dumb and embarrass yourself and don't not know things. Like, they expect you to not know things and ask questions. Like, you rather not know now when you're not responsible for someone's life than later on when you should have learned it in nursing school, and you know, now you don't because you were scared to ask. So
And what are you going to do when you go out in the real world and you have a patient that, and you don't know what to do? Like, you can't fake that. You need to know.
Yeah.
So definitely ask questions. Open your mouth and be like, excuse me, sir. I don't know what I'm doing.
And also go into the patient's room with confidence. Even if it's your first time doing something, go in there and act like you did it
Yeah.
already 100 times, because they can smell fear.
Yeah.
Those patients.
Honestly.
You go in there to do an IV and you're like, but you're like, I already did this 100 times. They're gonna be like, oh, okay.
yeah, if you're nervous, they're gonna be nervous.
Yeah.
Honestly, when I forgot what skill I was doing, but it was my first time doing it on a patient, and the patient was like, "Is this your first time?" I'm like, "Oh my gosh, no, I've done this so many times." And I have done it so many times, but on a dummy. I didn't say that, you know, I've done it so many times on a real person. I have done it, just not on a live person. It was my first time. So he's like, oh, okay. And it puts them at ease, and it puts you at ease when they're not nervous.
And you're gonna get both kinds of patients. The ones that are like,
question everything you do.
yeah, the ones that are nervous about having students. And then there's some that will be like,
yeah,
here's my
I
arm,
don't care.
do whatever,
Like,
yeah.
I love the patients that are like, oh, honey, I know you need to practice. Like, go ahead, do whatever.
And you gotta learn sometime.
Yeah,
which
I
is
love
true.
those patients. We have to learn. We appreciate you.
I want to end this by saying,
Oh God.
go and watch my video. You guys, seriously, it's a makeup tutorial. It's actually really insightful. You'll learn a lot of things. You don't have to subscribe or anything. Just watch the video. My name is Priscake C. P-R-I-S Cake C. Just watch the video. You guys will enjoy it. Thanks.
And I don't got a YouTube channel, so
if this video gets 1,000 likes, I'll make a channel.
Maybe I'm gonna be a nurse.
Get him to 1,000 likes, you guys, and he'll make one.
Watch him dislike it now.
1,000 dislikes.
1,000 dislikes, and I'll make a YouTube channel.
Alright guys, so thank you for watching my video. Leave comments down below on what you guys would like to see next. Thank you for watching.
Don't drag us though.
Yeah, don't drag us.
Because I drag back.
Love you guys.